Hello and welcome to Rajya Sabha Television. You're watching Discussion Today and I am Vishal Dahiya. Now, all of us have realized, and this is because of COVID-19 pandemic, that the importance of health sector can't be much more emphasized than what we have seen in the past year or so. Now, during the pandemic, it was pretty much clear how important and how significant is the health sector and the kind of linkages this particular sector has with various other sectors of the economy. That is why the need for spending more as far as health sector is concerned has been once again underlined in the Economic Survey 2021. And today we're going to talk about all these aspects, specifically what to expect from the budget in terms of how much more money needs to be spent, and more importantly, where it needs to be spent in the health sector, and also the challenges as far as this particular sector is concerned. And for more on this, we are joined by two experts with us. Let me first introduce our guest to you, beginning with Professor K. Srinath Reddy. He is the president of Public Health Foundation of India, PHFI. We're also joined by Dr. K. Madan Gopal, the consultant, senior consultant health at NITI Aayog. Welcome, both of you gentlemen. And let me begin with you, Dr. Madan Gopal. Let's start by understanding the thrust areas or the focus areas which have been, pointed out in the Economic Survey 2021, specifically with respect to the health sector. With the backdrop, understanding the way we have, navigated the COVID-19 pandemic and the learnings from there.
Okay, thank you, Vishal. The recent economic survey, which was tabled day before yesterday, it has strongly recommended an increase in the public health expenditure and the spending on health services from 1% to 2.5% of the GDP, which has been we have been always talking about that our country needs more inputs in terms of expenditure, and more budget is required so that we can reach a GDP of 2.5% of the public expenditure. That's the thing which we have been envisaging since the National Health Policy 2017. But during the COVID times, we have seen that there has been a marked, whatever systems we have built, it has shown its resilience, but they were not sufficient. We have to ramp up the testing capacities. We have to build in temporary beds. If you look at the bed ratio, that is, we have been envisaging that we would be having around 8 beds or 9 beds, but that is not adequate. The survey clearly points out that there is a need for increasing the beds across the country. To various studies, they point that we are having 7 to 15 beds per 10,000 population. The global benchmark is 25 beds per 10,000 population. And if we infuse more, it's a collaborative effort which is required from the government side as well as the private side, because reaching 25 lakh beds, we are currently around 12 lakhs or 15 lakh beds. Having 12 lakh beds to be built over a short period of time is a very, very big, because each bed costs around 25 lakhs per to operate and manage. That means equally 50 lakhs are required for making one bed hospital bed, including the operation cost.
Okay.
So that kind of expenditure is required. Another thing which has highlighted in the economic survey is the out-of-pocket expenses. We have been targeting the out-of-pocket expenses through, because the major chunk of the out-of-pocket expenses is on the diagnostics and the medicines. So government is having free diagnostic facilities, as well as they are having a Jan Aushadhi program. And the dialysis program is also meant for addressing this issue of out-of-pocket expenses.
Okay.
To augment that thing, the PMJ was also rolled out, and the economic survey has highlighted that it has made some corrections into the out-of-pocket expenses. And out-of-pocket, because that's one way of measuring how we are moving towards the universal healthcare, which has been envisaged in the National Health Policy, as well as we have committed to have a universal health coverage for the country.
Okay.
To achieve that, we have to see that how the new inputs are coming in the form of finances. The major thrust area with major gaps which are there is in the infrastructure. Whatever infrastructure we have been able to build, they are based on norms which were agreed in 2005. We claim that every 5,000, 3,000 population we are having a sub-center. Now it's 2020. If you look from the 2020 norms, instead of 1.5 lakh health and wellness centers, we would be requiring around 2.5 lakhs health and wellness centers.
Okay.
From where this money is coming, we have to innovate to reach these figures.
Okay.
The beds also, after the PMJ, the demand for the beds, even if best of the insurance schemes, if they start utilizing, that is 3% of the capacities are utilized, then we will require at least 15 lakh beds to cater to that population. That's why major impetus should be given on the infrastructure as well as that kind of innovation, which can make at least these two areas, that is out-of-pocket expenses, are reduced, as well as the infrastructure things are being taken care.
Okay.
Over to you, Vishal.
Okay, definitely. Infrastructure there is the core area of focus. Let me also bring in Professor Srinath Reddy here. Professor Reddy, in terms of the experience which we had during this particular pandemic, and as Dr. Madan Gopal was also highlighting, the way we learned how, what is lacking in our health system, and something which was again reiterated and re-emphasized during this particular pandemic. I believe we perhaps knew this in advance as well, but this particular pandemic taught us that the health sector can't be overlooked because then it becomes a huge problem for the overall economy.
Entirely agreed. We need to continue to invest and invest much more in the health sector for several reasons. Firstly, we cannot allow epidemics to derail our economy. Secondly, there are a large number of unmet health needs which need to be addressed for the entire population, and we need to ensure that we have the capacity to deal with that. Third, it is also important to recognize that healthcare expenditure itself can be an important drain on the economy unless it is adequately controlled. And for that, you need a very strong primary healthcare infrastructure, as well as the ability to deal with many of the diseases before complications develop. Lastly, the health sector also is a great employment generator. Even as technologies are beginning to reduce the amount of jobs available in industry, agriculture, and service sectors, it is the health sector that is going to be the big job creator. So for all of these reasons, we need to invest much more. But recognizing that we do need to invest in the infrastructure, but we also need a huge expansion of our health workforce. We need a multi-layered, multi-skilled health workforce in order to strengthen our urban and rural primary health care at all levels, as well as the district hospitals, medical college hospitals. And of course, the private sector also should pitch in to support the government. But recognizing that within the 1 year of the budget period, there are certain investments that are going to be made for the medium term and the long term. But there are some investments that have to yield returns in the short term. We need to definitely go ahead and invest in increasing the number of ASHAs, and if possible, try and invest more in the auxiliary nurse midwives and the male multipurpose health workers, so that our urban and rural primary health care can be greatly strengthened. Our district hospitals need to be strengthened in order to provide training opportunities for medical students, nursing students, and allied health professionals through new colleges that can take advantage of the upgraded district hospitals. So I think all of these are going to be absolutely critical. On one hand, we have to address the priorities of continued disease surveillance, because the pandemic may still be active and may return. And we need to ensure that whether it is testing or a vaccine administration or One Health program of surveillance of microbial migration from wild animals to veterinary and human populations, all of this we need to do. But simultaneously, we need to step up our health system to deal with the problems of routine healthcare, which will also continue to need attention.
Okay. So indeed, the infrastructure and human resource is something which you're also referring to, building upon that. That brings me back to Dr. Madan Gopal here. Dr. Madan Gopal, in terms of spending money and where to spend it, that's something which we are trying to answer this big question here, because the economic surveys also says that it is time that we take the spending on the health sector up to 2.5 to 3% of the GDP. Now, the two areas which both of you are identifying, infrastructure and human resource as well, perhaps we also need to give a lot more focus on the interlinkages between the primary, secondary and tertiary healthcare systems. That also, you believe, Dr. Madan Gopal, might be one of the focus areas?
Yes, they can't be treated separately. If you look at the evolution of the health system in the country, particularly the public health system, we are having tertiary level care in the form of medical colleges. We are having secondary level care in the form of district hospital. And below the district hospital, you are having community centers. And below that is primary health center and the sub-centers. These have evolved and beautifully they are having a good network. But the main problem with this network is the manpower. As Dr. Reddy has rightly pointed out, we require multi-skilled, multitask manpower. And all this structure they have evolved over the years, and they are based on certain population norms, based on the minimum need program, which was envisaged during the fifth five-year plan. After that, it has evolved, and the things started getting accelerated after the Alma-Ata declaration, where India was signatory. And after that, things started evolving, and a structure is there. And if you look at the evolution of the National Rural Health Program, the Rural Health Mission, initially it started, if you look at the evolution of that, first it was a family welfare program, then it was a mother and child program, then the RCH program, then it became the National Rural Health Mission, then the urban mission was added. Then afterwards, both the mission were under the umbrella of National Health Mission, which is still continuing. And the survey has rightly pointed out that this flagship scheme of the government, it has contributed to the development and the strengthening of the system. But lot more is to be done because the population is also growing. We have achieved something which we have factored during the start of the program. Now with the population growth and the other thing, unless that factor is also factored in, so whatever we are projecting today, that would be enough for 5 years. But we have to make a plan which can sustain the system for 15, 20 years down the line. So that kind of requirement is there.
Okay.
And we have been talking about raising the government expenditure to 2.5%. In this, because we are having a federated structure, in this, the states are also unequal partners. If you refer to this National Health Policy 2017, where the states are also, it has been envisaged that the states would be also spending 8% of their budget on this health, which is not forthcoming. If you look at that statistics, it is 1% to 11% varying across different states.
Okay.
If the states are spending 1%, then it would be years to reach to that number of 2.5%.
Definitely.
Nevertheless, whatever you have told that the focus should be on infrastructure expansion, networking, including the urban care, because urbanization is increasing. We can't be, it was rural-centric approach till now. Now we have to shift the focus toward the urban side also. Urban agglomerations are increasing. The population which was in 2005, it was 78-22. Now it is, the ratio is changed. 5-6% more growth has happened in the urban area, and the urban network has not increased. So now we have to focus on the urban areas without neglecting the expansion of the rural areas. Along with the manpower thing.
Okay, let me bring in Professor Reddy also here. Professor Reddy, on these points, as you know, Dr. Madan Gopal is pointing out, in terms of recalibrating our approach here of focusing not only on rural areas but also on the urban areas also, and all stakeholders. When we talk about public spending has to be increased, it's not only about the central government, the state governments, as Dr. Madan Gopal is emphasizing. They also need to be forthcoming in terms of increasing their share of spending there.
Absolutely, because 2/3 of the health expenditure in the public financing of health comes from the state governments and 1/3 comes from the central government. Though the central government does have centrally initiated schemes which it takes up substantial burden of, but overall it is the states who have to spend about 2/3 of the health expenditure. So unless they step up, we are going to have serious problems. And particularly in primary health care, we have seen how male multipurpose health workers have been sort of let off by the states, and that has suffered. And also the building of the infrastructure is also the responsibility of the state governments. But I also believe that it is absolutely essential for us to strengthen our urban primary healthcare services, as Dr. Madan Gopal has said, because not only there is increasing urbanization and peri-urbanization, there are a huge number of seasonal migrants who come into urban areas, and they are not counted as part of the general urban population. But as we have seen, they require health services, and they also need to be protected during pandemic periods. So I think we do need to create a stronger urban primary healthcare infrastructure, at the same time link up seamlessly the different levels of healthcare, right from the rural subcenter to the medical college hospital in the bigger city.
Okay.
And unless we pay attention to all of these as a country together, center and the states, public and private and voluntary, together, we'll be failing to strengthen our healthcare system.
Okay. One more aspect here, and let me go back to Dr. Madan Gopal. Dr. Madan Gopal, the economic survey also talks about, the need for regulator in the health sector. It says this is really important to resolve the problems which arise due to information asymmetry. So what exactly we might expect in terms of a regulator and the ambit of the regulation there?
This is very important and interesting question, because this regulation has been discussed, debated, I think it's almost 1 decade that the Clinical Establishment Act is it was enacted by the Central Parliament and adopted by some of the states. It's still, after it was enacted in 2011 and still in 2021, not all the states are in the ambit of this Clinical Establishment Act. So that's the kind of thing. Regulation means if you want to, if you have to take examples from the other countries where the clinicians and others, they had their own chambers which regulates the practice and other things. Our system has evolved, and we are having mix of public sector hospitals, the private sector hospitals. The act is applicable to the public sector and the private sector. But once it comes to enforcement, the only private sectors are they have been regulated. That's the only contention with the private people are having. They say that if the Clinical Establishment Act is there, it should be enforced to the government institutions as well.
Okay.
So here comes the question that's why it has not been, we have not been able to take up this act, despite having the legal banking, legal sensitive, some of the states they have adopted. The moments the acts, after the acts, the rules and the regulations are framed, and once it comes to once on order issue, people go to the court, and it matter goes on pending. That kind of thing happens. We have to, if we want to regulate the system, we have to see that how the fragmentation which has crept up into the system is defragmentized, as well as the regulation should be on a voluntary basis. It should not be enforced. The moment you start to enforce it, people will say that what is happening, and they will go to courts, and we won't be having this. Regulation is required. The standards are there. Everything is there. But once it comes to regulation and rules, then it becomes very difficult.
Okay.
And let's hope that how we can infuse, because quality standards are there, everything is there in that clinical act, but the only thing required is the enforcement of that.
Okay, that's very interesting. And Professor Reddy, in your views, how crucial and important is having a regulator in this particular sector? And as Dr. Madan Gopal is pointing out, it's to bring every all stakeholders on the same level, bring parity amongst them, both the private sector and the public sector.
It is absolutely essential, because healthcare sector not only deals with very vulnerable people who are requiring care, whose rights need to be protected, but there is also an asymmetry of information and decision-making power. The patient and the family generally cannot decide what is good for them. They depend upon the person providing the care, the doctor. And unless the doctor exercises that very responsibly and provides quality care and an appropriate care, we will be failing the patient, and the system will actually not deliver the services needed. As far as quality is concerned, I look at 4 dimensions. Is it beneficial? Is it safe? Is it cost optimizing instead of charging unnecessarily and wasting money in the care, also through unnecessary procedures? And lastly, does it provide satisfaction to the patient the family, and even the providers. In order to determine all of these, you require a framework of financial, technical, and social audits. And the regulator has to build in these systems so that ultimately the intended beneficiaries, the patients, are, or even the in public health services, whatever public health services are being rendered to the community, the patients and the communities are deriving the maximum benefit with the least harm, with assured satisfaction, and in the most cost optimizing manner. At the same time, even the people providing the services will require protection and support for performing their duties well. And therefore, the regulator has to ensure that the system performs in all of these measures to optimal satisfaction. Otherwise, our healthcare system, despite the investment in money, will not be able to deliver all the intended benefits. So we need more money for health, but also more health for the money in the best possible manner of utilizing our resources which are allocated.
Okay. Okay, that indeed is a very apt way of putting there, as Professor Reddy is pointing out. It's not only more money for health, but also more health for money, and that is where the regulator comes in. One more question before we bring this discussion to an end, Professor Reddy, and that's about the use of technology. The processes like telemedicine and digital health mission has already been envisaged. How technology can be further enhanced, the use of technology can be further enhanced to get more tangible results from that infrastructure, which both of you are propagating now, and perhaps we might see some of it being translated into actual results in the budget in terms of money being allocated there. So the technology and health.
Absolutely. Technology can be a great bridge. It can enhance access, ensure better quality monitoring, and also bring down the costs, because people do not have to travel every time to a hospital to get care if there is adequate telemedicine or home monitoring facility. And I think in terms of technology supporting the health services, there is no doubt. But it should not be seen as a substitute for health services, because we do need the health workforce, even at the front lines, to benefit from the connection that technology provides to specialist care. But there are a variety of ways in which self-care, care provided by even lay persons in the family or by other frontline health workers, can greatly enhance primary health care.
Okay.
But even in other levels of connectivity to secondary and tertiary care, and even monitoring the results quickly, I think technology can be a great enhancer and enabler, and we should utilize it very intelligently.
Okay, there it is on the technology part. Quick concluding comment from you as well, Dr. Madan Gopal, on the interrelation or correlation between technology and health and the need for focus there.
Yes, absolutely, because the ministry has been already focusing on the use of technology, and government has launched the National Digital Health Mission. That's the first step towards it is having 4 or 5 building blocks, and they will be working on that.
Okay.
Nevertheless, the underlying point which I want to emphasize, that while we are using the technology, as Dr. Reddy has rightly pointed out, we require the manpower, the workforce. So we have to see that when we are using in the technology is evolving, the practice is put into technology, not the reverse. So to be successful, we have to put the practice into technology, not the technology into practice. So that's the only thing which I want to say. And I
Okay, indeed. That also is a very, very important aspect there, and that also will need to be kept in mind. Thank you so much, Dr. K. Madan Gopal and Professor Srinath Reddy as well for sharing your views. And this is all about what needs to be done as far as health sector is concerned. Where are the focus areas? Where is that extra amount of money which everybody talks about need to be spent in the health sector, should be spent, as our panelists were pointing out. Let's wait and watch what exactly the Finance Minister has in store for the health sector. So keep watching Rajya Sabha Television.